Good morning and welcome to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County, soon to be Secretary of Health for the state of Washington. Thank you to Kathy Finninger, past President, Rotary Club of Houston, who provides us with these questions. And I'm Stephen Williams, Director of the Houston Health Department. Let's get started. A lot's happened in the last 2 weeks, right? Mm-hmm. Please confirm and comment on each of the following. If you've been in close contact with someone who is positive, count from the first day they started symptoms and quarantine for 7 days. If you have a negative test in 10 days, if you took no test. Question?
Yeah, so this is the new scientific brief that came out yesterday. It's not a change in guidance, and it's a scientific brief that came out from the CDC yesterday. And so they provide some pretty decent data, the CDC does, as to why they, what the numbers are. And I think it's important for people to know it is not new guidance. The guidance for the CDC on quarantine for COVID has not changed. This really informs people that if they're going to deviate from the guidance, what the risk is. And the risk is not zero. There remains risk. So if we go with 7 days and a test, which that test needs to be within the last 48 hours of those 7 days, there's on average, a 4 to 5% risk of post-quarantine transmission of virus, but it may be up to as much as 12.5%. And if you do 10 days, it's on average, about a 1% risk, but up to 10% risk of post-quarantine transmission of the virus. So it's not zero risk.
That's right. And we had this long discussion this morning with our colleagues in the health departments across the region as the health authorities, and the conversation was really about that, is that we don't want to give people confusion as this guidance, because the headlines are the CDC has changed its guidance, the CDC has changed its criteria. And that's not the case. What the CDC has said is that there are instances where it may make sense, but they really put it back to the local communities, the local health authorities within those communities. And so we are continuing with 14 days is the best way, and that is that we don't want to cut any corners when it comes to this pandemic, because unfortunately we're still in the midst of this.
Yeah. Absolutely. Isolate for 10 days after your first symptoms. You may return to work or school whether you've received a negative test or not.
Yeah, that has been the guidance from the CDC, and that's based on pretty solid work that it appears that beyond 10 days, so really at about 7 days of an illness, people either start getting better or continue to improve, or they start getting worse and wind up in the hospital. So for those folks who continue to get better, by 10 days with no fever and decreasing symptoms, their ability to transmit virus and infect somebody else is essentially zero. I mean, nothing in medicine is ever actually zero, but it's really, really low.
Yeah.
But you should still watch for symptoms for 14 days, the third question.
And so so it's a good question. So when you are ill and you either test positive or you have symptoms, we know that you are actively dealing with the virus. When you go into quarantine, the reason it's 14 days is that we've seen that people who have been exposed, that they may, anywhere in that 14 days, all of a sudden things can change. And so it's really shouldn't be comparing why 10 days versus 14 days, because it's two different questions. It's two completely different questions.
Because it's the incubation period of the virus itself. And so some people, it's 2 to 14 days. Some people, it could be a couple of days before you actually get, the virus is cooked up, and now here it is, and it's infecting you. You start to either develop symptoms or not have symptoms, but still be able to spread. Some people, it's all the way up until the 14 days. That's why, to be safe, 14 days is that magic number. But again, there are some additional, stipulations that Dr. Persse just mentioned.
Okay, Carlos Bustos text, can you make it clear vaccine does not cure the virus, it prevents it?
Yeah, we can.
Yeah.
Okay, Carlos, they're shaking their heads. Yes.
I mean, what vaccines do really, depending on what the kinds of vaccines are, but really what they're designed to do, and there are a number of mechanisms, different kinds of vaccines for different kinds of disease, but what they're designed to do is to really make sure that your immune system revs up as if you've had an infection. It revs up, and when it revs up, it actually gives you the antibodies to protect you just as if you had the infection, but you really didn't have it. And that's the importance of the vaccinations. And so really the most important thing is that we're giving you the immunity without having to go through the illness and the sickness or the infection. And that way it protects you. And really, this is the information that is the most exciting over the last few weeks here.
So that's why we had that reaction to that single shot, right?
That's right. That's right.
All right. Close contact means exposure up to 15 minutes at 6 feet or closer. Is that still over a 24-hour period?
Yep.
Yes.
Yep. It's not 15 minutes consecutively. If it's 1 minute here, 4 minutes there, 3 minutes here, if it adds up to 15 in a 24-hour period, you win.
Okay.
You win 14 days at home.
That's right.
Oh, really? That sounds pretty good. Can you assure that I'll be asymptomatic?
No, again.
What if I tested twice positive and was always asymptomatic? My boss said to return to work without taking another test.
So if you tested positive twice and you don't have symptoms and your boss is saying come to work, I mean, again, this goes back to what we talked about, is that the period that you should stay out of work should still be 14 days. I mean, that's the key message. Testing doesn't get you out early.
Well, so he tested positive at 14 or 10 days?
10 days. Yeah. So what the issue is that what we want to do is make sure that people aren't trying to cut any of those corners when it comes to what the guidance is and what the information is out there. So, I mean, in addition to that, you might have some additional thoughts.
Well, the only thought is that, you test, so you either develop symptoms or you test or you develop symptoms and test positive. So whatever that first day was, either the positive test for somebody who doesn't have symptoms or somebody had symptoms and then tested positive later, that's day 0. And then you go 10 days from there. If you keep testing, we have seen that people will continue to test positive beyond day 10, but we believe that's what's called viral debris. And so the test will continue to pick it up, but you should no longer be able to infect somebody else after day 10, assuming that you are improving symptoms, you've had no fever for 24 hours by day 10.
Now, if you get beyond that period of time, and let's say a couple of months later and you test positive. Now, again, this is without vaccines in the mix, but let's say that you test positive again. Now you need to really worry about reinfection. So what you shouldn't do at that point is go back and say, because I isolated for this period of time early when I tested positive, I'm okay now 2 months later. You should also, again, restart the isolation period. Yep. That's right.
Okay, I'll get a quick one in here. Do you anticipate the vaccine will be free?
I mean, mostly free. The vaccine, the needles, the swabs, that's all going to be free, but those giving it can charge an administrative fee.
That's right.
Either to your insurance or to the federal government or somebody.
Right. For the individual person getting the vaccine, there should be no cost.
Right.
Absolutely.
It could be to an insurance company or Medicare, Medicaid type of thing. Yeah.
Okay, well, thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask and let's beat this virus so we can get back to the things we love. Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Welcome back to COVID-19 Talk with local health authorities. This is sponsored by the Rotary Club of Houston. Vaccines. Everybody's talking vaccines. A CDC panel recommends first vaccines go to healthcare workers in nursing homes. Please explain the local distribution protocol and clarify the term healthcare workers. Where are health compromised seniors on the list?
I'm going to let you answer that question.
Okay. From now on, no questions for me.
Don't read the questions.
I have to. I can't blame you. Well, actually, they're saying that because I'm on the expert vaccine advisory panel for the state. The reality is that the protocol and the prioritization list is actually established at the state level. There will be some local flexibility, but that hasn't been determined yet. What you saw yesterday was the federal recommendations for a state, and states really have to ponder that and figure out where they're going to prioritize both seniors. But as far as healthcare workers and the definition of healthcare workers, the priority population actually is those individuals that are in hospitals and the support staff that are in hospitals. And the secondary prioritization would be those individuals working in nursing homes and home healthcare facilities, and the list goes on. We can post the press release from the governor's office that was released week before last.
Yeah, I think that most people can appreciate that a nurse working in an ICU taking care of COVID patients would be a higher priority than perhaps a nurse working in a cosmetic dermatology office in a non-acute care. Not that that nurse in the dermatology setting doesn't deserve it at some point, but probably not ahead of the ICU nurse. And so with the first amount of vaccine coming out, looking to actually come up, as I recall, you may know better, coming up a little bit short of across the nation, there's about 24 million people in priority 1, and there's about 20 million doses coming out, so we're going to come up a little bit short. So there's going to need to be a little bit of stratification there.
Yeah, I'm glad you brought that up, because the fact of the matter is vaccine won't be widely available for months, probably late spring or early summer. And so there had to be some prioritization, and the prioritization is based on those folks that are most at risk.
Yeah, I think the good news is that we see vaccines are around the corner here. It's not just around a long corner, it's actually this month. I mean, we're looking at soon that we will get vaccines in some format. And it's not going to be enough, as Dr. Persse just said, it's not going to be enough for everybody that we want to vaccinate. We want to vaccinate everyone. It's going to take time to get there. And so really what the guidelines from the CDC were, the recommendations by the committee, was really about saying, look, with the limited dosing that's going to be available, who do we prioritize first? And healthcare workers came in, those that are in long-term care facilities came in, and it's because of risk. And again, it's about repetitive exposure in my mind for healthcare workers, right? You've got somebody who's taking care of a COVID patient over and over and over again. You want to protect that person, and that's different than someone who may be in a different clinical setting but may have some exposure. So again, trying to prioritize that is tough. It's not easy, but yet it's what we have to do when you don't have enough.
Yes, and this issue around health compromised seniors, actually, just before we started the show, that was under discussion by the panel. I'm not sure where they ended, because I had to leave for the last 15 minutes of that discussion, but hopefully by next week we'll have some clarification on that. What is the status of the vaccine arriving locally?
Yeah. Well, we have to wait for the ACIP panel to meet on December the 10th, and then the FDA will likely issue an emergency use authorization within, I'm guessing within 72 hours after that, and then manufacturers start shipping. So, I mean, I would anticipate 14th, 15th of December on trucks across America.
Yeah.
And I think that there's some, I made this an assumption, but that the manufacturers have already got some pre-positioned in different parts of the country to make that transport quicker.
That's right. Yeah, I think the production is already happening. It's ramped up. I think the issue is going to be getting the ability to flip the switch to say it can now be administered. And so it's that piece that's already, and then obviously that means that there's just the logistics of getting it to communities.
If I have already had COVID, am I eligible to get the vaccine, and should I?
So I'm going to say yes. Now, we do have to wait for ACIP to come out with the contraindications to vaccination, which there will probably be some. But barring them listing that as a contraindication, and the reason is that we don't know how long your immunity lasts from previous infection.
That's right.
And similarly, unfortunately, we still don't know how long your immunity will last from the vaccination.
That's right. That's right. That's exactly what I was going to say, is that if you have been infected, we don't know if it's a few months or 6 months or what, that you're going to get protection because of the infection. We are hopeful that the vaccine gives you immunity for a longer period of time, hoping at least a year plus, and that gives the ability to, to give you protection. So what you don't want have happen is somebody who got infected back in March, April, says, oh gosh, I'm okay, I don't need to get vaccinated. And then it turns out they are reinfected because they could have been vaccinated, but they just chose not to. So this is going to be the other piece, and I think we have to remind everybody, it's for the most part, outside of the 6 candidates, that there's one that's a 1 dose. These are 2-dose vaccines, and we just have to remind people that you're in for 1 shot and a second 30 days later, by and large. I mean, 30, 45 days later, but it's a second dosing that's going to be required for most people as well.
And we're talking about people getting vaccinated. We're talking about people that are in what age group?
So with one vaccine, I want to say it's the Moderna, don't hold me to that, is been tested in people as young as 12 years of age. And the other one was 18 years of age and older. And most of I think of the others are all 18 and over. I think
they are.
I think the one is only down to 12. Is it Moderna?
It is Moderna. My understanding is that right now the pharmaceutical companies now are beginning additional trials for children that are younger than 18 or younger than 12, so they can also look at the effectiveness and the safety in those populations. So even though right now maybe for those populations, we may find that it's going to start to broaden to kids as well once those trials are finished.
If I live with someone who can get the vaccine first because of their job, can I also get it?
Probably not, I'm going to guess. We have to wait for that guidance to come out, but I think it's going to be for individuals based on their employment for the most part, or their personal health condition, but spouses and family members, I don't remember heard that talk yet.
I agree with Dr. Persse, David. It's going to be based on what they say, but I don't think that would be in the list,
right?
Unless there's some personal reason that.
And here's the other thing, particularly in the beginning, if you let Dr. Smith's spouse be vaccinated, then that means that somebody else who's still in that group may not have a vaccine available.
That's right.
Okay, thank you for joining us with COVID-19 talks with our local health authorities. We'll be right back.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat, for our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Oscar the Grouch here to tell you, yeah, you, to wear a mask out in public around other people. Sure, it'll keep you healthy, but more importantly, I won't have to see your happy, smiling face. And if you don't want to wear a mask, I've just got one thing to tell you. Scram! Go away!
Caring for each other because we are all in this together.
So wear a mask and have a rotten day, will ya?
Welcome back to COVID-19 Talk with local health authorities with Dr. David Persse, Dr. Umair Shah. AstraZeneca with University of Oxford announced they have good results with older adults who generated strong immune reaction. What is the impact of this entire study with the announcements this week on their acknowledged irregularities and omissions in their initial disclosure?
Well, I don't know all the specifics, but I will say, David, feel free to jump in, is that, this is the challenge that we've had with these announcements by the pharmaceutical companies. You don't want the announcements to be from the press release from the pharmaceutical company itself. You want to really have an independent public health organization, something like a Food and Drug Administration, the FDA, someone who's able to independently look at the data, look at the information, and make the best judgment on whether it's safe, whether it's effective, and be able to move forward with then recommending it or approving it for use in, whether it's in the U.S. or beyond. And I think when you see these irregularity comments, what I worry about is that it feeds into this mantra of, oh, I'm not going to get vaccinated. They don't know. And this little bit of these minor blips on the radar in terms of media information gets blown up by others to say, look, it's not safe. And I think that's why it's so dangerous when we hear this information. And I think it's so important for all of us to be waiting for the right agencies to make the call to say, yes, it's safe, it's effective, and then we should all be assured that we need to get the vaccine and it's going to help us.
I would say two things. One is, the Advisory Committee on Immune Practices, or Immunization Practices from the CDC, that is the group that we really need to wait. That's the group that's going to look at the data in detail and know what they're looking at and know what questions to ask. And so that's going to meet on the 10th of December. But the other thing, the other issue that you bring up that I really want to drive home is when it comes to, this little tiny reason, I think that we all need to take a step back and remember it's not all about me, right? This is a community problem. And so when it comes to getting vaccinated, I have a responsibility I have a desire not only to protect myself, I have a responsibility to my family members, my neighbors, my coworkers. And so when I make it all about me and I say, well, I'm going to let everybody else take whatever risk, I'm not going to get it, and nor am I going to let my kids get it, I got to say, I think that is the most selfish attitude. It really irritates me. And I've talked about this before, I'm so reminded when I was a kid and I had measles and how upset my grandmother was. Not that I got measles, I was going to be fine. She was upset that A, somebody else had given it to me, and B, who might I spread that to? What pregnant mom down the street might I give it to who's going to have a real problem with their baby? Because she knew I would be fine. It wasn't about me, it was about everybody else. And I think as a nation, we've got to move from this self-centered attitude to start worrying about our friends and neighbors too.
Yeah,
I'm sorry.
No, I'm glad you said that. And as EMS director, I think you'll appreciate this. I was watching something that there was a video of somebody who was speaking who brought up this really interesting metaphor, which is when you have sirens of an ambulance or a fire truck that's going on a road, everybody moves over. They take their individual, whatever they were about to do, go to the grocery store, pick up grandma, be late for the airport. They will put aside that for the fact that there is some emergency and it's helping someone else. It doesn't help the person in the car. It helps someone else. And we have a community solidarity to do that. And yet when it comes to something like this, we forget it. So I'm spot on. Spot on.
Sorry, I'll get off my soapbox.
Passionate health authorities.
That's right. I'm on the same soapbox he's on, unfortunately.
According to Moderna's chief medical officer, vaccinated adults could still infect those who are unvaccinated. How is that possible? Does that mean that we have to wait for everyone to be vaccinated before society is truly safe?
So I think what that means is the vaccine is, they're reporting they're like 95% effective. That means that 5% of people, the vaccine just doesn't, your body, it just doesn't respond to the vaccine. And so perhaps that's where that comment is coming from. But the other part of the comment is that we won't be able to drop our guards as a community until we really achieve, herd immunity, which is going to mean a lot of people are going to need to get vaccinated if we want to get to the point where we can take the masks off and not worry about what's going on in schools, not worry about the restaurants, and certainly all the whole entertainment industry with large crowds. We got to hit herd immunity before we can get back to normal.
That's right.
Another follow-up question that Carlos Butos actually texted again. I wonder once you get vaccinated, will it be required to wear a mask in 6-foot distance?
So the recommendation will still remain the same. It gets to what Dr. Persse just said, which is until you get to the point where we're assured of herd immunity or we're assured that so many people in a community have gotten the vaccine, and until we start to see data points that transmission has decreased, that we're actually turning the corner and not seeing these ups and downs, it's a consistent turning the corner, those 3 W's are going to come into play. We're going to have to wear a mask, wash our hands, watch our distance. And that's going to be absolutely critical all the way through even vaccination. But it is a light at a very long tunnel. It's the light at the end of that very, very long tunnel.
Some say the rush to market to get out vaccines quickly will disrupt studies or perhaps even better ones.
I don't think so.
Yeah.
This is a really good question, though, because it does raise sort of the ethical question of if we have a vaccine that is 90+% effective, and then we go to somebody and ask them to participate in a new trial. So I think all of the existing trials that are up and underway will continue, but it does raise that ethical question about unvaccinated populations if something new were to come along at this point. So I think all the existing ones, of which there are many, will go to completion. But it does raise an interesting ethical dilemma about something which might pop up next year.
Yeah.
The good news is that 95% efficacy with low side effect profile can be hard to beat.
You know, and there are, there have been some talks that especially if people start to travel internationally, that there may be carriers, airline carriers, that will require vaccination before you actually get on the flight. And so, now whether that happens domestically or not, I can't say, but that is something that I think, again, is another incentive for people to get vaccinated.
I have about a half dozen more questions, and I'm going to try to read this one really quickly.
Okay.
At this point, can we assume that all vaccines currently being tested will require an annual shot like the flu? Please get us on the same page with vaccines. There are 6 trials of different types. Pfizer, Moderna are ready to go to the FDA on December 10th and 17th. Are they harder to distribute and require 2 doses? Well, the Pfizer vaccine will be because of the ultra cold requirements. AstraZeneca and Johnson. What is Adenovirus? A-D-E-N-O-V-I-R.
Oh, Regeneron?
No.
Regeneron? Yeah.
No, it's not Regeneron.
Oh.
A-D-E-N-O-V-I-R-A-L.
Adenovirus?
They don't know. Easy to distribute. Okay. Please explain the recombinant protein that Dr. Hotez is involved with.
Yeah, I think maybe a little confused by the overall question.
Yeah.
I think the main focus of the question was really around vaccine and the distribution and trying to get the distribution out to communities, and that I think is something that we behind the scenes have to work out. So all that is something that we need to do. So I think key message is I don't want the public necessarily to worry about that. The public should worry about is when we're ready to say, get your vaccine, please get your vaccine.
Last I heard, the city was about 8.4%. They're talking about positivity rate. You said the curve looks like it did in July before it went on. Can you update us on the city and Dr. Shah in the county?
Well, in the county, I didn't see it this morning, but our positivity rate is now above 9%. I think it's 9.4, 9.5%. So we have seen a steady increase, right? We had come down city, county, right in that 5-6% range, and then have started to trail up. Now, it's not been as, I mean, I don't know if this is knock on wood, it's not been as bad as you've seen in other parts of Texas or other parts of the country. So we've done something well. However, we cannot let our guard down because it could be too early, and then all of a sudden we're in potential trouble.
Can we, an increase in testing, positivity is going up. Can we expect that they are directly correlated? If there's more testing, the positive rate would rise? Would we expect that?
No, this is a good question because it's a rate. It's not a number.
Right.
It's a rate. So I use the example of a bag of M&Ms. And let's say we know that in this bag of M&Ms, 10% of the M&Ms are red. And I reach in and I grab 4 M&Ms, and one of them is red. Well, you might say that's 25%. Well, no. But if you go in and you grab a handful, you get 40 M&Ms out of there in one handful, and 10 of them are red. There's your 10%, or 4 of them are red, whatever. There's your 10%. So the more tests you do, the more accurate your percentage is. It doesn't make the percentage go up. It's just more accurate.
Okay, is Regeneron still the go-to for emergency use for those who test positive and are in high risk for severe virus? And can it be used at home?
So Regeneron is the 2 monoclonal antibody medication that's being used for folks. And I can't remember, is that for folks who are critically ill, or is it for before they get critically ill? I know that the other one is for asymptomatic, not requiring hospitalization, but for Regeneron, I think, I can't remember what the indication is specifically.
Right, but it can't be used at home is the key message.
Correct, correct.
Yeah,
It can't.
Yeah.
that's right.
Okay, thank you for joining us with COVID-19 Talk with local health authorities. Dr. David Persse, representing the city of Houston. Dr. Umair Shah, representing Harris County for the next 2 weeks. And then Secretary of the State of Health for the state of Washington. Thank you to past President Kathy Fittinger, Houston Rotary Club. I'm Stephen Williams, Director of the Houston Health Department. See you next week.